Hello everyone, I'm Dr. Erinn Harris and I am your direct primary care doctor. If you haven't seen my first video, I did my first video blog regarding direct primary care, and I explained why I decided to go into direct primary care, why I started direct primary care practice back in 2014, April 2014, and the improvements I've seen in taking care of my patients and improvements I've actually seen in just me loving, practicing medicine again, simply because of switching to the model. And so just to quickly let you know, direct primary care is a membership-based model. We don't, direct primary care doctors don't contract with any insurance companies in order to pay for office visit fees. We contract with the patient. This establishes the relationship again back with the physician and the patient, instead of us having a relationship with insurance companies. This allows the patients to become our customers, and I always think of it as a AAA membership or gym membership, where you pay the gym in order to access being able to exercise, or getting for AAA, getting a flat fix. For direct primary care, it covers your office visits. For me, in my direct primary care, it covers your office visits, which are 30-minute office visits, unlimited access to me, so you don't have to pay a copay every time you come and see me. It also includes most of your labs and procedures. So that is the wonderful thing about direct primary care, is I have reestablished relationships with my patients again. So that's just quickly about direct primary care, but what I am going to do today is focus more on breast cancer. As you know, this is October, and this is Breast Cancer Awareness Month, and I did want to just give some information on breast cancer awareness to just raise the awareness, I guess you would say, of breast cancer. I didn't realize I think it was a dinner, and there was a oncologist, a hematologist oncologist, and if you don't know what that is, that's basically a cancer doctor that says that cancer basically is the second leading cause of deaths in America at this time, and breast cancer leads the way as the most what we see, the type of cancer that we see most in women. So breast cancer leads the way, and that's why there's so much focus put on breast cancer. So this actually hits home personally for me. In 2013, two of the women closest to me were diagnosed with breast cancer. One person in April 2014, Pastor Erinn Davis, who was a close friend of mine, passed away later that year from inflammatory breast cancer. She was diagnosed in April 2014 and passed away in she was diagnosed in April 2013 and passed away in December of 2013 of inflammatory breast cancer. And then later that year, in July of 2013, my sister, who I'm very close to, was diagnosed with invasive stage 2 breast cancer, which is a little bit different from inflammatory breast cancer. Right away, the next month, started chemotherapy, and then later that year in December, had a double mastectomy, and then later in January, had radiation treatment. And she gratefully is now cancer-free and does not have any signs of cancer, breast cancer. But I had two people on the end of the spectrum who I was very close to kind of go through not opposite things, but different treatments of breast cancer. So just to kind of give you guys some information about cancer, or just breast cancer in general. Cancer, if you guys don't understand what cancer is basically is when your cells are just dividing and growing out of control. What usually happens when you have any cell in your body, for the most part, your cells will divide into, you have one cell, that cell divides into two cells, and those 2 cells divide into 4, and those cells, 4 cells divide into 8, and so on and so forth. But those cells just don't keep growing and dividing. At some point, they will grow, have a lifespan, and then die. There's a certain point of time where a cell will die. Some for a couple of days, some for over 100 days, but they're they have a certain amount of time that they grow, develop, and die. So there is cell death that's programmed into the cell. With cancer, there's a loss of that cell death. So you have cells that are growing just exponentially, just growing, overgrowing, not maturing into a mature cell. So cells do mature. You have a cell that is an immature cell that grows up into a mature cell over time, and then it dies. Just like you have a person who is born a baby, grows up, and then dies. Kind of cells do the same thing over a short amount of time, but cancers don't do that. They're like toddlers, and they stay in that immature stage, and they just grow, and they just multiply in that immature stage. So the more immature a cell is growing and dividing like that, the more we would call malignant it is. And the more mature a cell is, the more benign it is. And so that's why you have kind of like these benign masses and these what we call malignant cancer cells. So breast cancer either is the same type of thing. It starts, as a cell that's growing and dividing but not maturing and not dying. And breast cancer can either start in the milk ducts of the breast, or it can start in the lobules of the breast. There's really 4 types of different breast cancer. There's why I say invasive breast cancer, should I say, and not kind of precancerous. So there is invasive ductal breast cancer, which is the most common type of breast cancer that we see. And there is invasive lobular breast cancer. And what I mean about invasive, that means it may have started in the lobules or may have started in the milk ducts, and it has somehow gotten out of that, or kind of fought its way out of the ducts or the lobules and invaded into the breast tissue. And once it gets into the breast tissue, it can travel into the lymphatic system and go up into your lymph nodes, and then can metastasize other places or travel other places like your bone or your brain, your lungs. So there's also 2 other major but rarer types of breast cancer, which is inflammatory breast cancer, again, which, as I said, my dear friend Pastor Ebony Davis passed away from. And there is also Paget's disease. And Paget's disease, I'll kind of explain more. But I just kind of want to go back to the invasive breast cancers. Your lobular breast cancer and your ductal breast cancer mainly form kind of masses that you can actually feel when you're doing a breast exam, or they kind of pick up on mammograms. That's when you'll kind of see a nodule or a mass when you have a mammogram if you're diagnosed with breast cancer. However, inflammatory breast cancer is a little bit different. It almost looks like a breast infection. I don't know if you've ever breastfed and had women, who I'm speaking of women, hopefully, I don't know any men who are breastfeeding, but if you've ever breastfed and you get a breast infection and they diagnose you with what's called mastitis. Inflammatory breast cancer can kind of mask like a breast cancer, like a breast infection instead of breast cancer. You have swelling and redness of the whole breast, and kind of dimpling of the skin, which is called peau d'orange, or it looks like an orange peel when you look at the skin of the breast. So the inflammatory breast cancer really can hide, and it's very difficult to diagnose by mammogram. You don't necessarily see that nodule on ultrasound or mammogram like you would see on a ductal or lobular cancer. So usually you would have to diagnose this by MRI. And then there's also Paget's disease of the breast, which is usually a breast cancer that starts around the nipple and will cause like an itchy rash or inflammatory rash around the nipple. And so those are the most of the breast cancer, types of breast cancers that we see and diagnose. I just know that the incidence of breast cancer seems to be increasing, and the incidence of cancer just seems, period, to be increasing. I'm not really sure. I have my own theories on that, and some people will call me a conspiracy theorist sometimes, but I know, I feel like, and I don't know if this is true or not, it may or may not be true, but I feel like since I've been a medical student up until now, that the incidence of breast cancer has really just increased. So if you're looking at this video and you kind of want to know, well, how do I know if I have breast cancer or not? I'm going to give you some signs and symptoms, and I'm going to give you the major ways to screen for breast cancer. So one of the signs and symptoms is a hard lump in your breast. You can either be around the breast or up under the arm in the armpit area. It also can you can have swelling or warmth or redness or darkening of the breast. You can have a change in the size or shape of the breast. So one breast may be larger, or one breast may be smaller than the other breast. Some women have some size changes. There's a discrepancy in the size, but not a significant change in the size that's different. You also may notice there's a dimpling or puckering of the skin. So where you haven't seen a smooth skin, it kind of dimples in or puckers in. And if you haven't seen that before, that will be a sign that there's something else going on. Also, a pulling in, or what we call a retraction of the nipples, that also may be a sign that something is not necessarily, maybe a sign of breast cancer going on in your breast. Any nipple discharge that's new, some people have nipple discharge if they're breastfeeding, or if you have nipple discharge if you're on certain medications, but this is new nipple discharge, or specifically bloody nipple discharge, that is a sign of, could be a sign of breast cancer. And also new pain in one spot. Sometimes you will have breast pain because of changes in your menstrual cycle, or changes in hormonal changes, or because of cysts. But if you just have, and usually that can occur in both breasts, but if you just have breast pain in one specific spot that doesn't go away with time, that tends to stay there, then that's a sign that you would need to follow with a physician to get a mammogram or a breast ultrasound. So I've kind of talked about some of the screening tests to see if you actually do, when you do notice some of those signs and symptoms of breast cancer. Of course, you definitely want to follow up with a breast cancer specialist, like a surgeon who specializes in breast cancer, a breast surgeon, or your primary care physician, such as me, in internal medicine, or your family medicine physician, or your OBGYN, your gynecologist, to follow up to do a breast exam and to do further testing. So the screening for mammograms is a little bit different from testing. If you actually find a symptom of breast cancer, you're going to go straight for a diagnostic what we call a diagnostic mammogram and ultrasound. And they may even want to do a MRI first based on your risk. So some of the screening tests, this is just to screen every year, no symptoms of breast cancer, is a mammogram, and I'm going by the American Cancer Society, but a mammogram starting at age 40 every year. A lot of times we ask, some people would like to do a baseline mammogram at 35, or anytime between 35 and 39, but definitely starting at age 40 for most women is a mammogram at least every year. Every 3 years, we recommend some type of clinical exam by a primary care provider, or your OBGYN, or a breast surgeon, to do a breast exam by a nurse practitioner, your primary care provider, every 3 years from the time you are 20 to age 39. So from age 20 to 39, you should at least have a breast exam every year, or every 3 years. Um, and by the time you're 40, you should have a breast exam done by a primary care provider, or again another provider like OBGYN, at least every year. So if you go in and you do an annual pelvic exam, of course you should have your breast exam completed at that time too, if you're over the age of 40. Now if you're in a higher risk group, and I'm going to explain what a higher risk group is, those kind of change, and those screening recommendations change a little bit. I'm not going to go into the screening recommendation for higher risk, but I just want to let you guys know what a higher risk group is. I know you guys heard of Angelina Jolie, who decided to do more aggressive measures to because she did have a higher risk, and that gene she had is the BRCA gene, which is the BRCA, or the BRCA1 or the BRCA2 gene. So if you have, you actually have a mutation of this gene, you actually have the BRCA1 or BRCA2 mutation, or you have a primary relative like your mother or your sister who has the BRCA1 or 2 gene mutation, you are a higher risk. If you have a strong family history of breast cancer, so you have an aunt, sister who was diagnosed at the age of 35 or younger, that's a strong family history for breast cancer. And also, if you have a history of breast cancer yourself, you've had radiation to your chest, that puts you at a higher risk. Or if you've ever been diagnosed with, you've had a mammogram, they saw something in your mammogram, did a biopsy, and they showed that you had atypical cells, or what we call LCIS, which is lobular cancer in situ, which is not necessarily breast cancer, but it is kind of like a precursor to breast cancer. So if you have any of those, that will put you at a higher risk, and your screening for that would be a little bit different. Again, I just want to kind of give you guys an overview. I really think this is important to make sure that you get your mammogram every year. If you haven't had your mammogram this year in 2014, October is a great time to get a mammogram. There are a lot of free mammogram screenings. If you know someone and you are a survivor yourself, or you know someone a survivor, actually I recommend getting involved in the marathons. There are a lot of marathons. You've had time to do it this year, to do the Susan G. Komen marathon, or to get involved in raising money to raise breast cancer awareness. And also, I would like to direct you. I like going to the Susan G. Komen website just to get information and find out information about breast cancer. And they have an excellent website if you want to know any more information about breast cancer. So again, Breast Cancer Awareness Month, this is October. I am wearing my pink and my pearls for breast cancer awareness. I don't actually have the ribbon, but I am wearing my pink. And again, definitely get your mammogram every year, and make sure that you follow up on any abnormal findings that you may notice yourself immediately. Again, this is Dr. Erinn Harris. This is your DPC doctor, and I practice internal medicine in Tyrone, Georgia. So again, I'll see you in 2 weeks to a month, and we'll talk more about DPC at that time. All right.